Good afternoon, Doctor.
Morning.
Ralph Marucci.
How are you? Mike Patera.
Mike Patera?
Yes.
So nice to meet you,
Nice,
Doctor.
nice to meet you.
How's everything going today?
Well, yourself?
Not too bad at all.
Alright.
Thanks for taking the time to see me.
No problem.
I'm here to discuss, for this particular office, I represent Empire Surgical, and again, for this particular office, I would have a pharmaceutical grade scar cream.
Okay.
What's great about this cream is it's a way of, for you to script for your patients post-surgical,
Okay.
or anybody who even may have a scar. What would you say is your patient's first reaction to the idea of a large incision for surgery as a cardiologist?
I would say what a lot of the women, what their concerns are is obviously certain clothing that they wear and visual, and they don't want to have a scar going across their chest.
Certainly.
You know.
Now, I'm sure your scars are probably tight and neat, but as you mentioned, women especially aren't very secure with the blemishes that are left over.
Yes.
Now, post-op or at that point, how do you address their concern for these scars personally? What's the protocol?
I would set vitamin E.
Vitamin E?
Mederma, yeah.
Okay, or Mederma?
Yeah,
Okay,
Mederma,
great.
one of those two I would suggest for them to use.
Right.
And usually we've seen some pretty good results with it for the most part.
Okay, that's great. Now, you know, just for me personally, I have a scar myself, and I tried Mederma. It cost me, you know, hundreds of dollars out of pocket, and I personally didn't see great results. I have a keloid type of scar, which I know in cardiovascular surgery there seems to be usually larger type of scarring, especially maybe amongst certain minority clients. And in those cases, you know, with those keloid type of scarring, there's very little effect with something like Mederma. Now, would you be open to perhaps scripting a scar cream for your patients? This way, post-surgically, they can have something that will actually be covered by insurance.
I could think about it. Do you have any literature or anything to review on it?
Yes, actually, I have a case study here that actually discusses a patient who came out of surgery, and you know, within 2 days of using our cream, has discovered amazing results. As you can see there, number one, the scar length has been reduced. Number two, the pigmentation and the coloring has been alleviated. And number three, the height of the scars have also been reduced. Okay, as I mentioned to you, this happens to be my personal prescription. You got just a little visual as to what it's like. It's compound, and for keloids, you're going to find that there are two different options. Again, for my type of keloid scars, this is how we actually script it out. Numbers 3 and number 4. One uses betamethasone, which is a corticosteroid. I think that could be very useful in terms of reducing the inflammation and the scarring. And the second one actually uses tamoxifen, which you may have recognized in other experiences. And that will actually inhibit keloid fibroblasts and reduce the scarring itself by decreasing the levels of TGF-beta-1s.
Okay.
So either of those seem more applicable for your keloid type patients?
Yeah, I think it's something that I'm new to.
Mm-hmm.
I think it could be a great alternative.
Great. Do you do a lot of open heart surgery, or do you do any type of vascular surgery?
Yes, I do actually. Yeah, here and there.
Okay.
More open heart.
That's
but,
great. That's great.
And we have the occasionally.
So rather than send your patient off to the store or look online for a cosmetic grade cream that's going to cost them X, Y, and Z out of pocket, wouldn't you feel more comfortable being able to hand them a prescription that includes a pharmaceutical grade scar cream proven to work, and that will actually be covered by their insurance?
Yeah, absolutely. I think it's something that I'd like to try out.
Great, great. Well, maybe you have a patient here today, or perhaps somebody in your office, that we can roll this out. It's a very simple process. I'd be happy to walk you through it. Do you have anybody in mind?
Actually, I have a woman this morning that came in that was, she was a little worried about scarring after the surgery, so you came in pretty much at the right time.
Perfect, perfect. Well, I'll be happy to walk you through that, and then I'll get you guys started out in the front with Debbie. I'll have her fax out this form once we're done, and we'll get the ball rolling.
Great.
See how the results are. I'll come back next week and update you.
Sounds good.
Great. Thanks so much for your time, Doc.
Thanks a lot.
Have a great day.
You too.
Bye-bye.